All right, here we go. Chapter 18, EMR class, Geriatric Emergencies. Let's go ahead and get started. So, geriatric patient, someone who is older than 65 years old. Got it kind of listed as the geriatric population in the United States, going to be the fastest growing segment of society. And the Census Bureau says 16% of the U.S. population, or about 52 million people, were 65 or older in 2018. Now, by the years 2060, this population is expected to double. So, we have to get used to running more and more of these geriatric calls. Natural aging process, which we're going to be talking about essentially throughout this entire chapter, result in a decline of functioning of all body systems. So heredity, lifestyle choices, several factors influence speed at which this decline happens. Now, one of the hard things to do is these kind of some prejudices that we might have, and I don't mean necessarily racial prejudices, which we shouldn't have as well, but these things of like we need to speak up louder, that we need to slow down the way that we talk and all of that. That may or may not be problems. So we don't with that patient. So we need to make sure that we don't prejudge these patients for physical or mental conditions. Many older patients, they're quite healthy and vibrant, and they don't take meds, and they run around town all day long and do lots of things. So we want to be thoughtful about the way that we interact. So because these older patients do experience health problems more frequently than younger people, most EMS systems will respond to many calls involving geriatric patients. Now, these calls are going to be less stressful for the patient, for you, if you understand how to effectively communicate with them. So it's going to be essential that you conduct a complete secondary assessment on all of these patients, and be especially careful while you're examining geriatric patients. We want to keep their spouse involved and informed of what's going on to help them kind of relieve some anxiety for them as well. Now, sensory changes, those are certainly things that start making some pretty big changes throughout our aging process. Two of the most socializing senses are going to be hearing and then sight as well. So many people experience some loss of hearing as they age, and then their ability to see often diminishes as well. So activities like walking and driving and all of that can become quite hazardous for this population, depending upon obviously how bad their hearing gets or how bad their eyesight gets. So, one of the things that you may or may not think about is because of these eyesight issues, it can kind of, as well as just some cognitive changes as well, some kind of confusion, it can contribute to mistakes in medications that they take. They may not remember, a person may not remember how many of these pills they take, and it happens to be a beta blocker, which decreases your blood pressure. And as you can see, that would be a big problem. And then other conditions such as cataracts and macular degeneration, all that kind of stuff, those things can develop as well. Now, these patients start to have hearing changes, may actually become deaf. Hearing loss is an invisible disability. You may or may not even know that they have hearing loss, and there's no signs of it, that you were able to see. So often hearing loss is more pronounced in the higher frequencies than a lower frequency. So a person may be able to hear low-pitched voices, but not hear higher-pitched voices. And then obviously some older adults require the use of a hearing aid. People with certain inner ear disorders are more prone to poor balance and falls than the general population because the inner ear has to work with your equilibrium. So if they have lots of problems in there, it can certainly give them equilibrium problems. So communicating with some of these hearing impaired patients, want to make sure you can be certain that an older patient can hear and understand what you say. And then you want to identify yourself, speak slowly, speak clearly when you are dealing with somebody that does have some hearing issues. Don't shout, ask if they can hear you, speak directly into their ear, maintain eye contact if they can read your lips. And if you're still having difficulty communicating, then offer paper and a pencil. And in the event that you know sign language, and they do too, you may move on to some sign language. That's what's shown here. So people who are visually impaired or blind, so you can, obviously we can see certain signs that help us know that someone's having problems with their eyesight, eyeglasses, or maybe a cane. A service dog, just asking is going to be a big part of finding out if someone has some sight issues. Now, in an emergency scene, as you can imagine, a visually impaired patient, they can certainly feel vulnerable during one of these. So we want to make sure that we're telling the patient what's happening, identify any noises that might, startle somebody or cause confusion, describe the situation and surroundings. Now, within this time, make sure that you find out their name. Everything's going to be some of the same stuff we do. We're going to address people by their name. We're going to give them support, all of those type of things. So identify yourself, look directly at your patient, speak slowly, explain what you're going to do. Show them respect, obviously. Don't talk about the patient in front of the patient. Now, with this population, you can certainly see some musculoskeletal and mobility issues. So, there's going to be, lots of changes. They're going to lose muscle strength. So part of the loss is the result of decreased physical activity, and then part is due to the aging process. There's two pieces to that. There's probably even more with injuries and just the body's processes it goes through, but those are two big ones. So decreased physical activity and then just aging. So the discs between the vertebrae become narrow, which can cause some loss of height, curvature of the spine, loss of flexibility. The bones actually become less strong because of the loss of calcium. So loss is especially pronounced in postmenopausal women. It can result in the development of osteoporosis. And what we're talking about there is that decrease in density of the bone. And then some balance issues also, which we talked about, could be with hearing issues or just, there's a number of reasons someone can start to lose their balance. So loss of muscular strength, weakened bones, decreased balance, all that results in an increased incidence of falls among this population. So, falls in older patients, they result in an increased risk for brain injuries because first off, the blood vessels in older people become more fragile. And then the brain gets smaller also as a person ages. So that can certainly increase the risk for brain injuries. Slowed movements, person ages, those movements become slower. Just help out where you can. Make sure we're not rushing people. Offer a helping hand to help someone get from A to B or whatever. Fractures, we talked about osteoporosis. So fractures of the wrist, spine, hip are particularly common. Now, geriatric patients may have a reduced awareness of pain. Remember, we talked about nearly everything within the body slowing down and not working as well. That all still even goes within the nervous system and pain receptors and all of that. So they may not, even realize the seriousness of their injury. So with this population, because they may have some spinal curvature or osteoporosis or whatever, if you need to immobilize them, to spinally immobilize them, or to even splint them, that might present itself as quite a bit of a challenge because of the way their body works or doesn't work right now. Now, we talked about osteoporosis. Hip fractures are a common result of osteoporosis. They occur more frequently in older women, and patients may have experienced maybe a minor stroke or a heart attack or confusion before they fall, and may not have even, or they may not have even seen an obstacle. So there's a number of reasons someone can fall, obviously. The injured leg usually is shortened in relation to the other leg. The toes of the injured leg are typically externally rotated. So every older patient who complains of pain after a fall needs to be examined at a hospital. If you remember back, we talked about that with, hip fractures, that sooner or later we just get to a point where let's just, when certain people fall down and they're telling you that they hurt, whether you see things that you think should be there or not, we'll just treat them as if something is broken because it's better to be wrong, treating them that way. Some conditions that may occur with advancing age, lots of things on here. We've kind of talked about a few of them. So as people get older, generally less able to fight off diseases, immune system with the same kind of thing becomes less effective, not able to cough as effectively. So a lot of times stuff gets stuck in their lungs, and that can certainly cause some more problems too, and even develop other chronic infections. And they have increased difficulty handling secretions. So we're talking about these kind of some medical considerations, lots and lots of reasons of how infections get started. So it says cardiovascular diseases. So those diseases, they affect the heart. They also affect the blood vessels. So as a person ages, the body loses its ability to speed up the rate of contractions of the heart. So at the same time, those blood vessels become stiffer and narrowed by fatty deposits. Because they're stiffer, they're not able to make the necessary dilation and constriction changes that happen. And then you have these fatty deposits. So it just kind of becomes a big mess. So these changes, they increase the occurrence of cardiac diseases, such as heart attacks, angina, congestive heart failure. Now, strokes and AAAs, or abdominal aortic aneurysms, those are two common conditions that are related to people with blood vessels, with blood vessel problems. Not just people with blood vessels, but with problems within their blood vessels. So geriatric patients may not have classic signs and symptoms of medical conditions. Older patients a lot of times have a decreased awareness or sensation to pain of a medical or even a trauma condition. And older patients are more likely to have a silent heart attack where they don't even experience acute pain. So some patients who experience a stroke will not even be aware of signs and symptoms that are present. So we want to make sure that when we're treating these patients, we are kind of looking at with a high degree of suspicion. So, we're kind of just thinking worst case scenario of what could be going wrong right then. Now, within respiratory disease, we talked about the heart and the vessels becoming kind of stiff and all of that. Same thing, those alveoli. Remember, those are where everything ends into the respiratory system, and you see those kind of berry-like sacs. That's the alveoli. Those things lose their elasticity as well. So what happens is that condition makes it harder to inhale oxygen and to exhale carbon dioxide, which hopefully we understand can be a real big problem. Now also, muscles associated with respiration become weaker with aging. As we talked about with a number of things, everything becomes weaker and not as effective. So it makes it harder for older people to cough, which we mentioned, which makes them more susceptible to a variety of respiratory infections. So two major types of respiratory diseases. We have chronic diseases and then acute. So chronic being something that's ongoing, and then acute being kind of just that little upper respiratory infection that someone might have. Now, patients with chronic COPD, chronic obstructive pulmonary disease, they may live with this condition for many years. A cold or other respiratory infection, it can upset their normal equilibrium and even result in a medical emergency because it's just so chronic and they're so almost feeble, they're unable to fight these things off. And then just a simple cold can really put someone into a bad place. So acute respiratory diseases, they can strike a patient very quickly. Pneumonia is a common infectious disease in the older patients. Minor symptoms can become a major illness in a short period of time. Remember, we talked about not being able to clear our lungs and that stuff being stuck in there and our body's not able to fight it off the way that it should. And, just one problem after another just leads on to something like pneumonia and then really gets people in a bad place. So physicians should examine these older patients who have congestion, especially if they have a possible fever. They probably need to be seen. So we want to make sure that we're, checking everything out, getting an accurate medical history. Medical history helps a lot. Make sure that we get a good medical history, treat their symptoms, and of course, get them to wherever they need to go, whatever that might be. So cancer can strike any part of the body. Patients call for help when complications from cancer result in everything from acute pain, shortness of breath, shock, even other medical conditions. One of the biggest things we can do, provide support. Just do what people need, good general supportive care, and then make sure that they get to where they need to go. So altered mental status, lots and lots of reasons. Someone could have altered mental status. So many of the medical conditions that commonly occur in older patients, it can result in altered mental status. So the three common causes in these older patients for decreased responsiveness are going to be lack of adequate oxygen to the brain, low blood glucose, or even hypothermia. So we want to make sure that we're assessing these people with decreased responsiveness and then provide whatever treatment that we're able to the signs and symptoms that we find. Medications, many older people take a large number of meds every day. They may see several doctors for different conditions, and then each doctor prescribes different medications. Some meds may even interfere with the other meds and cause adverse side effects. So sometimes people don't even take the meds as they're supposed to. One of the big problems is a lot of times these docs don't know what everybody else is, that they're being seen for something else, and then those two medications are interacting with each other in a negative way. So we want to determine which types of med a patient is taking. If they're being transported, do your best to bring the medications to the hospital. Now, infections and sepsis. So infectious diseases, those are illnesses that are caused by bacteria, by viruses, or even fungi. They may affect different body systems or even different organs of the body. Older people are more susceptible to this. They're more susceptible to contracting infectious diseases because they have weakened immune systems. So signs and symptoms of an infectious disease, they vary depending on the organism causing that infection, and then the body system that's primarily infected also. So some common signs and symptoms that we'll see be fever, fatigue, coughing, muscle aches, diarrhea. Those are all things that we might see as somebody has, an infection. So sepsis, moving on, sepsis kind of is that next step, severe, potentially life-threatening complication of infection. So sepsis occurs when chemicals are released into the bloodstream as a result of infection and trigger an inflammatory response throughout the body. It's most common in older adults and people who have weakened immune systems. So if left untreated, sepsis can progress to septic shock, and which septic shock, we haven't really talked a whole lot about that kind of stuff, but that's a condition in which the blood pressure can drop dramatically. And, obviously that's not going to be a very good thing. So septic shock has become a big thing over the last number of years within this population. So our role, understand that the older people are more likely to contract infections, develop sepsis, and recognize that older people often do not realize how sick they are. So we need to kind of think about these things and understand that, people are thinking about what's best for them, but sometimes they don't even know that, they might be sick, or it just kind of came on them slowly and it just becomes their norm. So if an older patient, if they show signs and symptoms of an infection, such as fever or diarrhea, fatigue, some of the things that we mentioned, muscle aches, coughing, and they should be evaluated by a physician to rule out the possibility of infection or even up to sepsis. Now, long-term care. Patients who require long-term care. So many patients with chronic conditions, they're being treated at home now by nurses or family members, and actually their lifespan has actually increased with this. So a variety of complex medical devices are used with patients who require long-term care. So some of the things you might see, what we're talking about is ventilators or oxygen enrichment devices, surgically inserted breathing tubes, monitors, a whole array of different things. So patients with certain heart conditions, they might have pacemakers, automatic defibrillators inserted under their skin, tubes inserted into a patient's arm or neck or stomach. They can provide fluid or food. Catheters may drain urine from a patient's bladder. So a lot of different things are going on at home. So you can see it's a feeding tube over on the right side, and then obviously a ventilator on the left. Now, as an EMR, we don't have a lot of roles in a lot of these kinds of things because they're really far outside of our scope of practice and our training. But we do want to assess the immediate problem. Maybe it's something that we can fix. In the event somebody's having a problem with oxygen, maybe their O2 is not turned on properly, or maybe their cannula is not on properly. We can still do things. So we want to make sure that we're taking those appropriate steps in caring for them. Don't become overwhelmed or distracted by complex equipment. Question patient about the patient's caregivers or the patient's caregivers about the problem. And the thing that we want to do is, help to stabilize the patient until EMS gets there. That's really our main goal, is to try to get everything back to normal the best we can until the next highest level gets there. Now, depression, most common psychiatric condition experienced by older adults. So elderly who live independently, it'll tell you that 1 to 5% of 65% or of 65 or older population has depression. So rates of depression in older adults rise significantly with the loss of independence. So for those who lose independence, 13.5% of those who require home health care are depressed, and then 11.5% for hospital patients. So it's more common in women than men. Contributing factors: living in nursing homes and assisted living facilities, and living alone, and then a loss of, a close spouse or a friend. Declining health, obviously, terminal illnesses, all these things are contributing factors. So we do want to pay attention for that. There's not much we're going to do and not much we can do, but we want to pay attention and maybe pass that on to the next people that's coming on. Suicide. So older men have the highest suicide rate of any age group in the United States. Older people, they choose more lethal means than younger people do. So this tendency results in more deaths from suicide in this group than any other age group. Now, many factors that contribute to this problem: so physical illness, especially terminal ones, loss of a loved one, alcohol abuse. So we want to make sure that we're listening to people, listening with maybe an ear that someone just says something that seems out of place, out of character for the moment, and make sure that we're passing that on. We also want to make sure that if we're somewhere and there's some signs of suicidal, thoughts or something, that we don't leave those patients alone while we're on scene. Don't allow people to go back if you can, into a bedroom by themselves or into the bathroom or those kind of things, because people have gone in and hurt themselves in those moments. So make sure that we're getting transport if you suspect they may be considering suicide, and always be alert for weapons. Dementia. So as people age, some experience a decline in mental function. So a pattern of decline in mental function, that's what we're talking about, is dementia. It's progressive, it's usually irreversible decline in mental functions. It's marked by the impairment in memory and can result in decreased reasoning, judgment, comprehension, and then ability to communicate verbally. You see 20 to 40% of people older than 85 have some degree of dementia. So senile dementia is a general term used to describe an abnormal decline in mental functioning seen in older patients. And this dementia can be caused by many things. So strokes, hardening of arteries, heredity. Alzheimer's disease, most common type of dementia. So Alzheimer's disease is a chronic degenerative disorder. What it does is it attacks the brain, and it results in impaired memory, behavior, and thinking. With these guys, you may or may not see some mood swings, and feelings that people are plotting against them. And also these patients can wander at night and clearly are at an increased risk for falls. In terminal stages, patients may be unable to walk, lose control of their bowels and bladder, become unable to swallow. So when caring for them, make sure we speak clearly in patient's name, let them know what we're doing at every step of what we're doing. And then when you may need to rely on family members or caregivers to get you a good history, use a kind and caring approach. And hospice care, kind of end-of-life issues is what we're talking about. So hospice, healthcare program that brings together a variety of caregivers to provide physical, emotional, spiritual, social, and economic care for patients who have terminal illnesses and who are expected to die within 6 months. So hospice care, it's provided in their home or maybe even a special hospice facility. So interdisciplinary programs, you'll have several different people doing several different things. So they can provide pain relief, other supportive care. Or you might even have one person that's doing, multiple roles, but multiple roles are being provided. So one of the goals of hospice is provide pain relief without the use of needles or IVs. So it's provided through oral meds, maybe special pain relieving patches, medicine placed in the mouth between the gum and the cheek. EMS is usually called when a patient experiences unexpected problems such as shortness of breath. So if you're called, it's important to know the purpose of hospice and what type of care it provides. Patients who are under the care of a hospice may have advanced directives, and they can certainly, typically will have DNRs, request to not be resuscitated. So what is an advanced directive? We just mentioned that. Patients who have a terminal condition, they can have a document. What it does is it outlines the care they want to receive, that they want to and do not want to receive if they're not able to make their own medical decisions. So advanced directives, they may include DNR orders, so a do not resuscitate order. A DNR order is a request to withhold CPR and other life-saving measures if a person's heart stops or if they stop breathing. Important to know about the regulations, so make sure you know your protocols, make sure you know the state. Every state can be different, so make sure you know what is right and what is not right. If you cannot determine whether an advanced directive is valid, begin appropriate medical care and leave questions about living wills to physicians. So what we're saying is, if you get on scene somewhere and they tell you they have a DNR, but they cannot produce one for you, just continue on with BLS. So essentially CPR. Until somebody else can make a decision. You can call the ER to where that patient would be transported. You can make a couple of phone calls and see if there's DNRs and all that. But unless you have one in hand, my own personal recommendation is you continue going on with BLS care. You don't have to do anything advanced. The paramedics don't have to, but at least continue on BLS until you get that thing in hand or a verification of one. Elder abuse. Older adults who are physically weak or mentally compromised are at a high risk for abuse by a spouse, family member, friend, caregiver. So it's hard to detect because those who are at highest risk of abuse are often isolated from public view. So elder abuse may consist of physical, sexual, or emotional abuse, financial abuse, neglect, lots of stuff going on. Bruises and burns and trauma, signs of neglect, appearance of malnutrition can certainly be a problem. Once again, we're going to look for things like bruises and, different stages, those kinds of things. So if you do suspect abuse, make sure that you report it. So summary, natural aging process, I think that just sums it up right there, results in a decline in functioning of all body systems. So everything has already peaked. We've climbed the mountain, got to the peak where everything's the best, and we're on the downhill towards the end of how well things are going. So altered mental status, we see 3 common causes. So cold, low blood glucose, so low blood sugar, and then lack of adequate oxygen to the brain. So hypoxia, if you might think about that term. A lot of these patients have chronic conditions, and that is geriatric conditions. So we'll see you in a bit for the next one.